I'm ready when you are. All right, fire away.
Phalanges, proximal 1 through 5.
All right, your proximal phalanges, starting with the captain, the big toe. So the proximal ones are 1, 2, 3, 4, 5.
Phalanges, distal 1 through 5.
The distal one, so further away, this is 1, 2, 3, 4, 5.
Metatarsals 1 through 5.
We didn't have the middle ones? Maybe not. Okay.
Yes, we do, sorry.
We did have middle? Okay. The first one only has proximal and distal, but the 4 lateral ones, in between the proximal and distal, you have middle of 2nd, 3rd, 4th, and 5th. Metatarsals were next. Okay, just proximal to that are the metatarsals, so they use the same numbering convention. So this is your 1st, 2nd metatarsal is with 2nd toe, 3rd, 4th, and 5th. All right, the cuneiforms, how you find it is the first metatarsal. I'm gonna be on the medial side and I'm gonna push in fairly hard until I get to the indentation. And if I feel the bump here, that's navicular. I've gone too far. So I gotta go back. There's a little indentation right there. So that's the juncture between the first metatarsal. That's my first cuneiform. You said all 3 of them, right? So the first one lines up with the first metatarsal. The second one right here lines up with the 2nd metatarsal. The third one right here lines up with the 3rd metatarsal.
Cuboid.
All right, cuboid. I'm just gonna rotate you a little bit. If I'm pushing on the lateral side until I get to the indentation, that's the styloid process. So that indentation is the cuboid, so it's right there, and it lines up with both the 5th and the 4th metatarsal.
Navicular.
All right, navicular's back over on the medial side. Easiest way of doing it is just feel for the most prominent bony prominence on the medial side, and that's right there. That is going to be your navicular.
Talus.
Talus? Okay. If I find the medial and lateral malleolus, I'm going to go with an imaginary line connecting them on the inferior side. So bottom part here, right in the middle, you can relax. That is going to be the talus. That's right there. That's in between the malleoli.
Calcaneus.
Calcaneus is your heel bone, so you can find it right there.
Tibia.
2 bones in the lower leg. The tibia is the one, the distal portion is the medial malleolus. So this is the tibia, fibula's next, I'm assuming. Lateral malleolus, that's gonna be my fibula over here.
Gastrocnemius.
All right, is there more on the posterior side? Do I need to make her flip over or not? Okay, flip over them. Okay, so your 2 calf muscles, your gastrocnemius is the more superficial one, is soleus next. Okay, as I come down to the tendon on either side, contract your calf muscle for me for a second by pointing. Okay, so that's the gastroc. This is the soleus. It's deeper underneath the gastroc. Plantaris, you'll never know where it really is, but we know it conjoins with the Achilles tendon down in here. So I'm just going to point to the Achilles tendon to get it.
Tibialis posterior.
All right, flip back over for me. What's the next one? Okay, so the next up we have tibialis posterior, flexor hallucis longus, flexor digitorum longus. That is Tom, Dick, and Harry. So all of those come around the medial malleolus. Now, the tibialis posterior, I could point to it here, but I know it inserts on the navicular, so I'm gonna put my finger right there. Now, flexor hallucis longus, I want you to flex your big toe for me. Just your big toe, flex it. When she does it, do it a couple times. Okay, I'm going to feel the tendon around the medial malleolus. Now you can flex your 4 lateral toes. that's your flexor digitorum longus. If I wanted to, I could palpate them down here for each of those as well. Just clinically, it gets more involved over here.
Tibialis anterior.
All right, tibialis anterior, that does dorsiflexion and inversion. So I'm going to resist that movement a little bit, and the tendon is popping up. I can feel it right there.
Extensor hallucis longus.
All right, extensor hallucis longus. I'm going to ask her to extend her big toe, bring it up. I'm going to resist it, and that's this tendon that you can see right in there. Digitorum. Extensor digitorum, oh, brevis?
Brevis and longus.
Okay, longus, bring your toes up for me. I'm resisting. It's these tendons that are right here. The brevis, I'm gonna have you go ahead and do it again. You can see it from this side. Bring your toes up. You're gonna see a muscle contraction right there. That is, relax for a second. Just distal to your sinus tarsi, that's your extensor brevis, digitorum brevis.
Peroneus, tertius, brevis, and longus.
All right, rotate just a little bit for me. When she everts her foot, I'm gonna resist it. Let's see if the tendons come up. You can see them there a little bit. So this right here is brevis and longus. You can relax. The brevis inserts on the styloid process, so I could palpate the brevis there. I know the brevis and longus are there. The longus disappears underneath the foot, so I could go ahead and palpate the perineal brevis, perineal longus right here. Is tertius next? All right, tertius is anterior to the lateral malleolus. So although it does eversion, this one assists with dorsiflexion. So I'm gonna have you evert and kind of dorsiflex a little bit. I'm not gonna see it, but that also comes down to the styloid process, so I'll palpate it right there.
Forefoot.
All right, forefoot, midfoot, and hindfoot. Forefoot includes your metatarsals and your phalanges. So you can pick any landmark in there. I'll pick fifth metatarsal. Midfoot is going to be your cuneiforms, your cuboid, your navicular. So I can point to any of those. I'll just point to the cuboid while I'm here. And then hindfoot is going to be your calcaneus and your talus. I'm just going to point to the calcaneus right here.
Medial and lateral longitudinal arch.
All right, while we're on this side, your lateral longitudinal arch is the lateral aspect of your foot, parts of which are going to be making contact with the ground. I know the fifth metatarsal is part of it, so I'm going to point right there. On the medial longitudinal arch, that is typically more elevated, made up of all of the bones of the first ray and a lot more soft tissue. I can point to any of those structures that make it up. That's part of your clinical SIGs. I'm just going to choose to point to the navicular because I know that is the keystone of the medial longitudinal arch.
Transverse metatarsal arch.
Okay, the transverse metatarsal arch technically goes from the MTP joints all the way until I get up to the mid-tarsal joints. So you can point to it anywhere. I'm going to point to it where it's cutting across the metatarsal heads. So I'm going to point right there in between the second and third metatarsal head.
Interphalangeal joints.
You have one IP joint that's right here. The four lateral toes each have two IP joints. The one that is further away is your DIP. The one that is more proximal is your PIP.
Metatarsal phalangeal joints.
Okay, metatarsal, phalangeals. So I have 1, 2, 3, 4, 5 MTP joints.
Intermetatarsal joints.
Intermetatarsal joints. So my metatarsals line up here. They come together at 2 points. They come together at the head and they come together at the base. So these joints are going to be proximal to those MTP joints. So I'm going to point to the one that's right here in between the head of the first metatarsal and the second one, right in there.
Tarsal metatarsal joints?
All right, after the metatarsals, then I get to the tarsal joints. So earlier, I'll just do it over here. So I have the styloid process, and I have the cuboid joint, cuboid bone right here. The space in between it is the tarso-metatarsal joint that goes all the way across, otherwise known as the Lisfranc joint.
Subtalar joint?
Subtalar joint. Bend your knee a little bit, just like that. Okay. I'm on the right side. Okay, if I go ahead, here's medial malleolus. If I go 1 finger breadth below it, that is going to bring me to the sustentaculum tali, which is on the calcaneus. If I then go 1 finger breadth posterior, that's the tibial tubercle of the talus, which is on the talus. So subtalar joint means below the talus. The juncture right in between those 2 points is going to be below my talus, hence the subtalar joint.
Mid-tarsal joint?
Mid-tarsal joint. So all of those tarsal bones, we'll do it on this side because you can see it. Here's my navicular. The first cuneiform bone is distal to it. So that would be one of the joints of the several mid-tarsal joints.
Talocrural joint?
Talocrural joints. So that is the joint made up from the talus, that's right in between the malleoli, with the tibia and the fibula. It's an upside down horseshoe. So if I were to bisect the medial and lateral malleolus and I draw a line right in the middle, that's approximately going to be that talocrural joint.
Inferior tibiofibular joint?
All right, now, again, I've got my 2 malleoli. I'm gonna go on the superior portion of it. I'm gonna start on the lateral side and go 1/3 of the way to the medial side. So I'm not in the middle, I'm 1/3 of the way. That right there is that inferior tib-fib joint. So there's the malleolus, 1/3 of the way across. It's above the malleolus.
Anterior, inferior tibiofibular ligament?
All right, the exact same spot I just pointed on. The anterior ligament is in the front, posterior is next. So same anatomical height, but now I'm going to be on the posterior side of it. So it's right there.
Interosseous membrane?
So the interosseous membrane is between the fibula and the tibia. Remember, the fibula is offset on the lateral side. So this is not in the middle of the lower leg. It's on the lateral 1/3, coming all the way up to the knee. I can point to it anywhere on there. I'm just gonna go right above where the joint is.
Styloid process of fifth metatarsal.
We did that earlier. That is the base of the 5th metatarsal that sticks out. It's right there.
First MTP joint.
MTP joint. I think we did that one before. That's gonna be right there.
First metatarsal cuneiform joint.
So here's the first metatarsal. Remember, I'm looking for the slight indentation that's right there. So this is the cuneiform. That is my first metatarsal cuneiform joint.
Navicular tubercle.
So we found the navicular earlier, the most prominent bony landmark, so that's my navicular.
Talar head.
Talar head, okay. So medial malleolus, 1 finger breadth below it, that's going to be sustentaculum tali. Here is the navicular that's right there. In between those 2 points is the spring ligament. The spring ligament holds up the talus. So that means my talar head is right there.
Medial malleoli.
Found that already? That's there.
Sustentaculum tali.
We just found that. That's 1 finger breadth below.
Medial tubercle of the talus.
All right, from the sustentaculum tali, I found it again, it's right there. I go 1 finger breadth posterior, and it's right there. It's a little painful sometimes. And that's the most posterior attachment of your deltoid ligaments.
Fifth metatarsal.
Right there. I'm going to point to it just above, just distal to the styloid process.
Fifth MTP joint.
Fifth MTP joint. There's the phalange. There's the 5th metatarsal, so the joint is right there.
Calcaneus.
Found that before?
Peroneal tubercle.
Oh, that one we haven't found. So from the lateral malleolus, she's at 90 degrees, 1 finger breadth below, right there, that is going to be my tibial tubercle. That's where the longest goes this direction, brevis goes that direction.
Lateral malleoli.
Boom.
Dome of talus.
Dome of the talus. Okay, when I told you the landmark before of finding the talus, I'm on the inferior side of the malleoli, okay? Right dead in the middle, I said that's the talus, but that is the highest portion of the talus, so that is the dome of the talus. You can put the foot in slight plantar flexion to expose it, but if you put it in too much plantar flexion, you pull these tendons tight and you can't get to it. So just a little bit of light plantar flexion and you can push in there.
Inferior tibiofibular joint.
I think we found that one before. That was there.
Dome of calcaneus.
Flip over real quick. All right, so here's the calcaneus. We want to go to the most proximal portion of it. So I feel bone, 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 bone. Now I have soft tissue, which is the Achilles tendon. The dome is the highest part of it, so it's right there. Oops, right there.
Medial calcaneal tubercle.
I think we found that before, right? Oh, no, medial calcaneal tubercle. Flip over for me. The medial calcaneal tubercle is on the plantar aspect, so I'm on the calcaneus. I'm gonna push on the medial side. Just relax for me. I gotta get through the aponeurosis or the plantar fascia, and it's right there. Okay, so I'm pushing on bone, 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 and then I go into soft tissue right at the very end. That's where it's located. That's where like your plantar fascia, your long and short plantar ligament come off that too.
Sesamoid bones.
Sesamoid bones are just, well, not much. Here's your first MTP joint. Your sesamoid bones are right there and just slightly proximal to it, but I can point to the joint itself and I'll be fine. Like right where the metatarsal, I should say, joint is there. They're underneath the metatarsal heads. That's why I'm saying slightly proximal.
Metatarsal heads.
Yeah, so metatarsal heads coming across. 1, 2, 3, 4. There's the 5th one.
First metatarsal head.
Right there.
Springs of it.
We found that one before between sustentaculum tali and navicular. So it's right there.
All 4 deltoid ligaments.
All right. So we have the tibio-navicular. So that's going from the malleolus to the navicular. We have the anterior tibio-talar. That's right there. We have the tibio-calcaneal. That goes in a straight up and down direction. And then we have the posterior tibio-talar, which goes to that medial tubercle. So that's right there. So that's the direction going from anterior to posterior.
Posterior tibial artery.
Is nerve next? Okay. So when we say Tom, Dick, and Harry, the AN is that tibial artery, posterior tibial nerve. That the artery you know you can possibly find because you'll feel the pulse, The nerve, you won't know that you're on it, but they both are just posterior to the medial malleolus.
Long saphenous vein.
Long saphenous vein is the drainage. Well, the great saphenous vein goes the whole way. It's also called long. Starts at the foot. You don't know when you're on it. You can sometimes see it. I think I can faintly see yours a little bit there. But it is just anterior to the medial malleolus. So it's approximately right there, but you're not going to know for sure when you're on it.
Dorsal artery.
All right, you find that on the dorsum of the foot, and it is located between your extensor hallucis longus and your extensor digitorum longus. So I'm going to resist her bringing the toes up. Bring them up for me. All right, and at least I can see that tendon right there. I'm going to put my finger right here. It's about the level of the cuneiforms. I can't feel it, but it's right around this area right here. And it's absent in 12%, but sometimes it's also just faint.
Anterior talofibular ligament.
What are the next ones? All three.
Calcaneofibular,
Okay,
posterior
just
talofibular.
rotate a little bit. These are your lateral collaterals, all coming off the lateral malleolus. If her foot and ankle is in 90 degrees, the ATF comes forward at a 45-degree angle. The CF calcaneofibular is directly inferior to it. And the posterior talofibular goes in a posterior orientation at a 45-degree angle. So it's 1, 2, 3. Sinus tarsi, relax, is the indentation that is just anterior and inferior to the lateral malleolus. You can see my finger going in there.
Head of the fifth metatarsal.
Head of the fifth metatarsal is right there.
Retrocalcaneal bursa.
Is the calcaneal bursa next? Flip over for me. All right, you have two bursa sacs that lie approximately at the level of the dome of the calcaneus. The retro, because retro means back in time or behind, is between the calcaneal dome and the Achilles tendon. The calcaneal bursa sac is between the Achilles tendon and the overlying skin. Both of them located right here.
Plantar epineurosis.
All right, we'll keep you in this position. That's the same as a plantar fascia. It's coming off the medial, here's where I can find the medial tubercle of the calcaneus, and then it's spreading all the way across.
Deep transverse metatarsal ligament.
All right, here's my metatarsal heads. That's right here. The deep transverse ligament goes between all of them. So if I'm on the head, that's good enough. The ligament itself is connecting in between the heads of the first, second, third, fourth, and fifth.
Dorsal tarsal ligament.
Is plantar the next one? All right. So the tarsal bones, we said, here's the styloid process. So here is the cuboid. Between the cuboid and coming over here would be the third cuneiform. Obviously, there's ligaments that are holding it together. The plantar tarsal ligaments are on this side. Flip over for me. The dorsal ligaments of the same. Here's the styloid process, cuboid. Now I'm at the third. That's the cuneiform. This is the dorsal tarsal ligaments.
Interosseous tarsal ligaments.
So dorsal is on this side, plantar is on this side, but directly in between the bones, so I would point to it in the same spot, are the interosseous ligaments.
Long, short, plantar ligament.
All right, they're coming off, I'm not going to have you flip over, but here we are coming off the calcaneus again. It's coming off the medial calcaneal tubercle.
Malleolar fluid.
So I've got one both on the medial malleolus and on the lateral one. It's a little groove or route. Wait, which one? Okay, so this one is for Tom, Dick, and Harry, and the one on the lateral side over here is for the perineals.
Superior extensor retinaculum.
All right, we have two retinaculums. The extensor one, it's holding down your extensor tendons. So the inferior one is coming below the level of the malleolus, and it blends in with the perineal. So I'm gonna point to it right here. The superior one is above the level of the malleolus, and it's coming off the fibula, so I'm gonna point to it there, but I would also be correct if I was there. So both of those are my both of those are my extensor retinaculums. What's next?
Superior lumbar retinaculum.
All right, now for my perineal retinaculums, there is a superior and inferior. So the one that's below the level of the malleolus, that's right down here. That is my inferior, blends in with the extensor retinaculum. My superior one, if I go just above the malleolus, that's coming in this orientation, but if I'm on the fibula, I'm going to be fine.
Flexor retinaculum.
Flexor retinaculum is holding down Tom, Dick, and Harry, so that is coming off the medial malleolus to the calcaneus. So if I'm on the malleolus, that's fine. I'm just going to go in between that imaginary line and find it right there.
Anterior and lateral compartment.
Okay. The anterior compartment makes up the bulk of the anterior part of the leg. So if she does dorsiflexion and inversion, she's contracting her tibialis anterior. When I see that going on, then I know I'm on that compartment. Lateral compartment, I'm just gonna ask her to evert, so go ahead and evert. Your other evert, there you go. Sometimes you'll see some movement that's right in there. That's how you're gonna go ahead and find the lateral compartment. Is superficial and deep next? Yeah, just try and roll a little bit, just like that. Superficial compartment is closer to the skin, so I'm gonna point to it right there where your gastroc and soleus is. The deep compartment is hidden underneath this. So if you point to the gastroc soleus and you say it's deep to that, you'll be fine. That's it?